All right, everybody. So today we have back on the podcast Dr. Ralph Esposito. How's it going, man?
Thanks for having me, man. Happy to be back.
Yep. So we were talking, it's been over a year now. It's almost, I was looking at, I think it was September of 2018, which is just wild to me
Wow.
that doesn't feel like I've been doing it that long, but it's great to have you back on. And so you are a naturopathic physician, right?
Yes.
And, I forget even how I think I first heard about you on another person's podcast. And then you and I had just started talking on Facebook. And then we chat a little bit here and there. You introduced me to some other people. So it's been great. So what is the primary focus of what you do as a naturopathic physician?
Sure. So my focus is primarily on preventive medicine. So I utilize my skills as a naturopathic doc to utilize the combination of Western and Eastern medicine. But really, I mean, depends on what you define as Eastern medicine. Essentially, it's lifestyle interventions that help prevent the major killers in America. My focus is on hormonal dysfunction, but it's very hard to focus just on hormonal dysfunction and not consider, heart disease and Alzheimer's and stroke, cancer, all of those things. They all come into play. I like to look at it from a hormonal perspective because I think hormones have a huge impact on many chronic illnesses. I mean, just one, diabetes and hyperinsulinemia is just one condition that contributes to all of the above. Essentially, what we do is we try to prevent these major killers. We optimize health through nutrition, diet, lifestyle, exercise, supplementation, and if necessary, medications. But oftentimes, we try to keep those as a last option.
Great. And I think just hearing that instinctively, it's like, yes, I completely agree. I think that makes sense. I think a problem with traditional medicine a lot of the time is that it's just like, here's more medication. Let's not look at the root of the problem. However, I will say, and this is more just for everybody listening, because I know you and I kind of are on the same page here, but I think naturopathic medicine oftentimes gets a bad rap depending on who you're talking to. And so there are the people who are, I mean, for lack of a better word, almost like quacks with it, where they are saying things that aren't founded in science. There's not data to support that. And I know, like you and Dr. Carrie Jones, that you guys don't fall into that camp. And I've had the opportunity to talk with both of you. But why does it get that bad rap? Why are some of these people going to that extreme? Because you also have the extreme in traditional medicine too. You have the people who, you know, it does not even necessarily depend on their age, because I've met people of all ages who are like this, but they think if there aren't, it's not 20 years of randomized controlled trials, that it's completely BS, that it's all just about the medications. And, these are a lot of the same people that see a patient for 15 minutes before they switch over to the next one, and they don't get to know anything about the patient's history. So I think you can get good information from both camps,
Mhm.
but maybe you can explain why naturopathic gets that rap, because I don't want to say that that doesn't exist. I think that side does exist too, like the people who give it a bad name.
Sure, it does exist, and I think that exists in mostly any type of medical profession. I have colleagues who completely are opposed to all vaccinations, and they're medical doctors or they're DOs or nurse practitioners. And then there's actually a whole group of naturopathic physicians who are pro vaccinations. Like they make it very clear, like they are pro vaccines and immunizations. So yes, this whole idea, and it doesn't just apply to vaccines, it can also apply to medications and drugs. I think this whole dichotomy between the profession exists because there are people who got into the profession who believe that the only way, and really it comes down to the idea of, are you integrative or are you alternative medicine? I am not an alternative medicine practitioner. Anybody who wants to consider me as CAM, complementary and alternative medicine, I correct them immediately and I tell them that is not what I practice. I am not telling you do this, not that, right? I'm not telling you take this herb, don't take that medicine. I'm
Right.
saying you can take that medicine, but understand that that is a medicine that is not truly getting at the underlying cause of your condition. Now, do I think that what I consider integrative medicine, do I think that people should be doing both? Yes. What I want to do is I want to marry the best of both fields. I want to marry naturopathic medicine with conventional integrative medicine. And as you said, there are people in this naturopathic field who are very extreme on that end, and also there's MDs and DOs who do the exact same thing. And I think that exists is because a lot of people got into the profession with pretty bad experiences. So they perhaps had experiences with other medical doctors or professionals where they botched a surgery, or they gave them a medication to their parent or their sibling and it caused them to get sick. I have a very similar experience. My father, the medical system failed my father. My father recently passed away in June, actually,
Sorry to hear
from,
that.
that's okay. He's a great example of how horrible the medical system can be. So he basically passed away from chronic illness. So he had emphysema or COPD, onset from cigarettes. He had cerebral vascular disease, coronary artery disease, peripheral vascular disease, leukemia, CLL, and colonic ischemia, like tons of conditions. And all
Yeah.
of these are preventable. But the only thing that they were doing for him is giving him blood pressure meds and statins and all these other medications and making no really focused effort in trying to correct his chronic illness. So I could have easily taken that experience and said, you know what, F the medical system, they're horrible, don't take medications, they
Right.
kill you. I look at that and say, he had a bunch of amazing doctors who really did the best to their ability to what they knew. And unfortunately, they just didn't know better. And that's where I think the big issue comes with, naturopaths being considered, non-traditional or alternative or contradictory to conventional medicine. But really, and I recently did a post on this, is, you know, I'm a naturopathic physician, but there are medical doctors who think just like me, and there are naturopathic doctors who think just like me, and there's chiropractors who think just like me. And what I try to do is marry the art and science of medicine. And I'm not integrative, I'm not naturopathic, I'm not functional. It's just good medicine.
Mhm.
And if you're evidence led, not necessarily evidence based, but if you are led by the evidence, because evidence is always changing, then
Mhm.
I think you can move yourself towards an area that is promoting good actual medicine so that you can help the patient based on the information that you have and knowing what you don't know.
Right. Yeah. I mean, I think that's a great way to say it. I think, like I said, when I have you or other people like Dr. Jones on, I do kind of even feel like this almost it's more like an internal pressure to explain it because again, there's the stereotypes, but I agree with everything you said. And I think it's troubling sometimes when you have maybe like a traditional medical doctor who is obese and they don't look at like your nutrition or anything. And it's like, man, like I'm not like I'm for medication if it's necessary. There are certain things that can't be prevented. I mean, at least as far as we know, like autoimmune conditions, I think that's still a big question mark with those. But I still think like how can you ignore some of these huge factors like just lifestyle, nutrition, all of that. So I think it's great what you put out. As far certainly there are things you put out that I don't know what the right answer is because it's just out of my
Sure.
wheelhouse. But for things that I know are in my wheelhouse, I've not really come across anything from you where I'm like, oh, I really disagree with that. So I think you're putting out good stuff, and obviously keep at it. So one thing, actually, this was just a question. So I know we kind of rescheduled from a previous time. At the time, I said I wrote down to ask you. I saw you did your VO2 Max test. I guess that was a couple
Yeah.
months ago now. What did you get? Do you
What was
remember
my
what your?
VO2
Yeah.
max?
Do you remember the score?
Oh man, I don't remember. I remember it being good.
Yeah.
Uh, I don't remember exactly what it was. I was actually recently trying to get the raw data from that to get my respiratory quotient
Okay.
to try to understand, my ability to metabolize carbs versus fat. I did not. I don't remember exactly what my score was. I really wish you asked me before. I would have pulled it up and pulled
Yeah.
it out.
Well, message me, or I'll shoot you a message to remind you. Maybe you can get the data before I post it. I'll put a little link in here or something.
Did you do yours as well?
I did mine back in college, and then I think I might have told you I had some heart issues, so I did it
Yeah.
again, and it was fine. It was right around 50, so that's like
Okay.
pretty average for my age. It wasn't good, but I also don't do a ton of cardio, so obviously I'd like it to be higher. I might, I'm pretty out of shape right now, like relatively speaking, so I might do it
Yeah.
again just for fun, as they're obviously very fun tests to do, right? So,
Yeah. I I I am not a big runner,
mhm.
but I remember them telling me that, for somebody who really doesn't do a lot of cardio, your results are pretty impressive. So I was like, sure, I'll take it.
Awesome. Yeah, yeah, I'll be interested to see. So you mentioned, how you process carbs versus fat, and something
Right.
I'm sure this was prompted by a post I read from yours a couple months back. But in terms of like a lot of lifters tend to consume a high carb diet very long term, I mean, like
Hmm.
decades. So I have my own opinions on it, but I kind of wanted to hear your thoughts on not just a like moderately high carb diet, but some of these people who are doing, 5 to 700 grams of carbs a day, on and on and on. And then I've even seen some of these same people then start talking about taking metformin, which is a whole nother thing we could probably get into. I've seen people who have completely normal HbA1cs taking metformin long term. So I guess we can break that into two if you want, but let's start with like the chronic high carb diets.
Yeah. So it's there. So number one, before we even get into that, trying to argue nutrition is probably as difficult as trying to argue religion or politics, right?
Yeah.
It's essentially what you're asking for if you try to convince somebody on nutritional science. And the reason why is just because there's so much epidemiology and observational studies, and RCTs on nutrition is very difficult, the same way an RCT is difficult on supplements compared
Hmm.
to a pharmaceutical. So, with that said, a lot of my interpretation and a lot of my understanding of the literature and of my clinical assessment is based on my clinical experience and biophysiology, right? So, the biochemistry and the physiology of it, and what does this really mean, and what can we understand from clinical biomarkers? And what essentially it comes down to is that diets are high in carbohydrates. So weightlifters and athletes try to eat a high carbohydrate diet in order to replete themselves of glycogen. So if they try to have their liver store more glycogen, they think that they can go into glycolysis quicker and allow them to utilize energy more efficiently if they're going on higher bouts of exercise and training. Unfortunately, the glycogen that we use for most of the weight training is in our muscles, right? And when we don't really need a lot of glycogen in order to be efficient in our exercise. You need sufficient, but excessive amounts of glycogen and glucose are not necessary. So what do athletes do? They increase their carbohydrate intake to try to replete themselves of sugar so that they can use it when they have an exercise bout. And now, some athletes would say, well, when I go keto, my performance completely drops. And yes, that is absolutely correct. But the opposite of keto is not a 50% carbohydrate diet,
Right,
right?
right.
It is a carbohydrate that repletes you of glycogen, but not super saturates your liver with glucose and starch, essentially. So what people are then doing, then they start having a high carbohydrate diet. They start eating, you know, these sports drinks and bagels and bread and potatoes, and they're increasing their insulin levels. So they the only time that I would suggest somebody that they would want any type of increase in insulin is post exercise. But the problem is that these athletes are doing it, morning, evening, and night, even when they're not training. And hyperinsulinemia can then lead to weight gain, and it leads to insulin resistance. And essentially, what that causes, it contributes to heart disease, it contributes to metabolic syndrome, and increases fat deposition, and it causes chronic illness. So that's the major issue that I have with individuals who try to do high carbohydrate diets. Now, on what was the second part of the question? Oh, on metformin.
Hmm.
So essentially what we think metformin prevents the synthesis and the absorption of glucose. So what we try to do is metformin works on certain enzymes, something called AMPK, and we think that has downstream effects on mTOR. But essentially what we think is that people are taking metformin as a longevity drug.
Right.
And I think that's where you were going with this,
Hmm.
right? And there is no data suggesting that metformin promotes increases lifespan in individuals who are not diabetic.
Right.
So it helps people who are diabetic, helps them live longer. But I think the way it helps those people is because they're diabetic.
Right.
So if you are not diabetic, right, and I would be surprised to see what people do comparing it to like dietary intervention, where you put somebody on a very low carb diet, do you increase their lifespan compared to individuals who are on metformin for life?
Hmm.
And I would suspect that you have similar, if not greater benefit in those people who are actually using lifestyle and diet and exercise. There is actually some evidence that metformin can impair muscle function. So it can actually decrease mitochondrial function, reduce the amount of ATP utilized by your mitochondria, and decrease energetic output or decrease muscle output. So there actually is a downside effect of metformin, and we think that has to do with its impact on lactate levels. So it can prevent the mitochondria from getting into a zone 2 type of exercise where it becomes most efficient. And that's how we see the negative effects potentially of metformin on athletes.
Yeah, great explanation, and I think it is interesting. I mean, I see it more on like bodybuilding forums than I do hear like people on Instagram or anything talking about it. I understand their reasoning like behind it. I just don't know if it's completely thought out, especially if you haven't. I mean, I know people who haven't even measured, like haven't even gotten blood work for HbA1c or anything like that, and they're taking it. I'm like, how do you know it's going to really do anything? And if it does something, how do you know that that's a beneficial effect for you? You know, I mean, it just might not be necessary. And you're just throwing, again, I'm not anti-medication, but you're just throwing it in there without really having that much knowledge on it.
Well, I think hemoglobin A1C is less valuable than we think it actually is.
Yeah.
So hemoglobin A1C is designed to help diagnose diabetes.
Mm-hmm.
So it's great if you are diabetic, but if you're not diabetic, there's so many variables that can impact the accuracy of your hemoglobin A1C. So in short, if your hemoglobin A1C is less than 5.5, I know the cutoff is 5.7, but if it's
Mm-hmm.
less than 5.5, does that mean that a 5.0 or 5.1 is better than a 5.5 or a 5.4?
Right.
No, I don't think that is true, because
Right.
there could be so much fluctuation in that area. And I know it gives you a 3 to 4 month time span of what your exposure is to glucose, but what if you have thalassemia? What if you're on testosterone replacement therapy? What if you are constantly exercising and you have a slower red blood cell turnover rate? Or what if you're catching red blood cells in a certain lifespan? There's so many different variables that can impact the efficacy of or the accuracy of that test. So what I usually tell people is, do glucose testing. You could do continuous glucose monitoring. You could do finger prick testing with like a diabetic at-home finger prick blood glucose test, or you can do something like an oral glucose tolerance test, which can tell you how are you responding to sugar in real time, rather than trying to assume what happened over 90 days.
Right. Yeah. I mean, I think that's just people's propensity to push everything to the extreme and, assuming that like more is better or less is better depending on the variable. If somebody did blood work and they said, oh, well, my fasting glucose was 80 and this time it's 70. I mean, some people might say, oh, it's better. Now I want to put it to 60 or something. Like, do we have any data that shows that that is going to improve anything for you, longevity or really any important factors? And I think the answer is no. We have these ranges in blood work that show, okay, certain things when they get really out of range are problematic. But within a normal range, I mean, that could just depend on the day you took the blood work, and we're talking about blood work specifically, but that could go for a lot of things. And I think people always have this extreme mentality because I think by virtue of what we do, we like pushing our bodies. We do like to improve, and we kind of have that like type A personality where we're always striving for better. And I've done this myself too. It's actually probably a good analogy. So a D dimer test is something that if like you go to the ER and you say I have chest pain, they'll test your D dimer to see if you have like a pulmonary embolism. And mine tested positive one time, and then they did a CT. It was negative, but since then, I'm like, I need a low D dimer. And my doctor was like, why are you testing this? Like, you don't, but in my head at the time, I was like, I need this as low as possible. And it doesn't matter, if it was a little bit under or very under, it's fine. So I've definitely fallen prey to that as well.
Yeah, and that's scary too, because you're thinking about a life-threatening type of condition.
Yeah.
But then you have to also consider like what is the positive predictive value and negative predictive value of this? What's the rate of false positive versus false negatives? There's so many different variables that come into it. You have to be a very informed clinician in order to actually take that information. So I applaud your curiosity, but shame on you for going crazy into that.
Right, right. So something I have written down to ask you about, and again, I know at the time I wrote these down, I had a little bit better idea of specifically why, but I'm sure we can still talk on it. Ashwagandha was something I wanted to ask you about. This was, man, I first heard about this. It's been a while, and people were talking about it's this adaptogen. It does all this and this. I just was curious your maybe personal experience with it, or if you have people take it, what you think of it.
Yeah, so ashwagandha, the Latin name for it is Bithynia somnifera, and there's many different forms. But when it comes to ashwagandha, we think that the withanolides in which is a constituent found in ashwagandha, withanolides named after Withania, we think that those are constituents, alkaloids in the herb that help have an impact on the body. Now, we don't know exactly how it works as an adaptogen, but we do know that it can help reduce perception of stress and reduce cortisol levels. We're not sure if it works centrally, if it works peripherally. We're not entirely sure, but we have, centuries of anecdotal data and from Ayurvedic medicine saying that this is actually effective. And then a little bit more of the literature came out and found that one of the ways that we think it is helpful is it also can be used for hypothyroidism.
Hmm.
And one potential mechanism is that it helps with the deiodinase enzymes. So there's these enzymes that help convert T4 to T3. And we think that ashwagandha and those withanolides help convert thyroid hormone to its active thyroid hormone, which is called T3. So that's one benefit that we think it has in terms of improving your sense of well-being and your energy levels. But it can also have an impact on, we think it can help improve the sensitivity of your cortisol receptors. So by having a more sensitive cortisol receptor, we're allowed to respond better to stressors, which then can help auto-regulate the body's own innate ability to reduce stress. So we don't know the exact mechanism per se, but we do have data suggesting that it can also improve fertility in men and in women, and it can increase FH and LH levels. So that tells us that it might be working centrally in the brain to improve FSH and LH, which then can improve your spermatogenesis, your sperm motility, and your sperm volume.
Hmm.
So, again, this is part of the evidence-led type of medicine. If you told me, tell me exactly how it works, like what receptor, what enzymes, I named a few, but I can't tell you in exact detail because we just don't have the exact amount of data. But utilizing it as a clinician, it is quite helpful for individuals who are under extreme amounts of stress. And on top of that, we have a lot of other drugs that we don't know exactly how they work, but we know that they do. And I think this falls into a very similar category.
Right. Yeah, no, that's a good point. I mean, it's not like every medication that's even taken, we have an exact mechanism, like, to every little detail. And if we know it
Mm-hmm.
works, sometimes things are even pushed through trials because we see that they work. So that's a good point.
Yeah.
So recently, I forget who I was speaking about this with, but people talk about fasting, intermittent fasting. It's not new, obviously. People have been doing it for a long time. I actually started doing it for GI issues. I started like once a week. I just did like a 24-hour fast. I don't think it's magic or anything. Obviously, for me, it was nice to not feel super bloated for the day, and I find it can help me out even from a convenience standpoint. I've said this a lot of times on the podcast and in my own videos that the reason I like intermittent fasting, the typical kind of like 8-hour feeding, 16-hour fast, is really just it's super convenient for me to not have to try to eat every 3 hours or anything like that.
Yeah.
Um, but I was just curious how you've implemented it and if you've seen anything maybe in the last few years that's convinced you it's more helpful than you thought or less helpful than you thought.
So I think there's a lot of data now coming out on intermittent fasting. And I have a very tough time synthesizing what people are reporting because everybody has a different definition of
Hmm.
intermittent fasting. When I think of intermittent fasting, there's different subcategories. There's time restriction and there's prolonged fasting. And then there's also fasting mimicry, which
Hmm.
is like Volta Longo and the fasting mimicking diet. So when people tell me intermittent fasting, I automatically assume they mean time restricted feeding or time
Right.
restricted eating, which is not eating for 16 to 18 hours a day. Some people even go to like the 20 hours a day. Some people just do like the OMAD, right? The one meal a day.
Right. Right.
We are starting to learn now that there is a good amount of literature suggesting that time restricted feeding can improve health. It can improve metabolic markers. It can improve insulin sensitivity, but there is no data suggesting that it improves longevity. There's no data
Right.
saying that if you eat only for 8 hours of the day for the rest of your life, or for the majority of your life, that it's going to add X amount of years to your lifespan. What I can tell you is that by constantly or by not constantly having elevated insulin levels or elevated blood sugar levels, you alone are having benefit on your body system. So insulin is anabolic and pro-inflammatory. So when you can keep those levels lower as long throughout the day as possible, then you are essentially reducing potential for inflammation and for anabolism. And we think that part of this has to do with insulin, we think, can inhibit autophagy. And autophagy is, for another word, self-eating. It's when the cells recycle and get rid of any type of organelles or cells that are not functioning very well, and how essentially just helps recycle them. A great analogy for this is quite old, but people who used to use PCs and they used to do like disk cleanup, right? And you
Yeah.
would go like into system tools, disk cleanup, and you would see like the blocks of everything getting cleaned up.
Yeah.
That when I think autophagy, that's what I think. I think, the computer, my brain, and the body is taking all of these cells that are all scattered all over the place, figures out which ones are, corrupt or damaged, gets rid of them, and then clears them up and like reorganizes them in a nice little Lego block or a Lego set, right? That's what I think. That's a good analogy that I think of it. And what we have known is that naturopathic medicine, it's funny because, intermittent fasting is so new and trendy right now, but
Hmm.
I was looking at my notes from med school, like one of my first semesters, and one of my professors was talking about fasting, and he was like, well, there's several different types of fasting. There's low calorie fasting, there's water fasting,
Hmm.
there's, lemon juice fasting. And I was like, our profession, naturopathic medicine, has been doing this for decades,
Hmm.
right? For a century. And now it's becoming more fashionable. But Chinese medicine and Ayurvedic medicine, they have all been doing this for decades, right? For thousands of years. And now we're starting to realize that it actually does have benefits behind it. You mentioned that you do it because it helps with your gut health, and I think there's proof to that. So, what are the cells in the body that regenerate the quickest? It's usually the GI tract. The
Hmm.
GI tract is because you're sloughing off cells all of the time, right? And if you are constantly eating and causing irritation to that area, the potential for inflammation and irritation is higher. So if you take 24 hours and give it a break, or even if it's 16 hours and give it a break, perhaps the ability for it to recover and regenerate is much more improved, which then can allow you to feel better. That's all theoretical, however,
Right.
but that certainly makes sense. And for patients that I know that have like IBS or IBD, um, I always have them do some type of fasting, whether it's weekly or daily or quarterly, some type of restriction on how frequently they're eating.
Yeah, I mean, especially I think for IBD, IBS, there's something to be said for just the amount of volume that you're putting through there. And so right now I'm about 205 pounds, and I'll be starting dieting down next week. And I'm looking forward to it. My GI is looking forward to it. I think just by having less volume, and like I said, I'll still be incorporating the 1 day of fasting. I will say, for me at least, and from the evidence I've seen, I'm not convinced that if you were to, because like you said, fasting's been around for a long time. I first heard about it in terms of intermittent fasting in 2011. So it's funny that it's kind of trendy now, but I mean, that was almost 10 years ago, and it wasn't even new then. But for me, I don't think if you were to eat the exact same number of calories with the exact same macronutrient breakdown, but you just crammed 16 hours of food into 8 hours, I don't think, other than the convenience benefit, you're going to
Right.
find that much of a benefit. Yeah, you have less insulin at the other times, but then you have more during that time. There might be some small differences, and maybe we disagree
Right.
there, but I just don't think that you're going to see much of a benefit, and longevity really not at all. I think inherently when you do some sort of fasting, you do end up eating less food. And a lot of times I've noticed people will eat healthier food in order to, or more filling foods, which are often healthier
Sure.
foods, to kind of like make sure that they're satiated throughout that more of that fasting period. So I think inherently it has benefits, but I don't think it's just because of the timing itself.
Yeah, and so I think what your argument is individuals who are not eating for 16 hours a day, but then try to cram in, you know, 10 hours of eating into 8 hours and achieving the same amount of calorie intake, are those two people getting any different benefits? And I think when it comes down to it, it's like, yeah, those people may not or may um, gain weight or not lose weight, but what else is happening during that time period where you're not eating? And I think we need more literature or more research in that area. A lot of it's on animal studies,
Hmm.
but Sachin Panda, he does a great job at trying to digest all of the literature on this, and he's constantly putting out stuff on Twitter. So for you or for your listeners, I think that's going to be one avenue to get a little bit more information on this, because if anybody's going to continue to learn about it, it's going to be from him.
What was the name?
Dr. Sachin Panda.
Okay. Yeah, I'll try to like put the name down there. So this is actually funny because we might disagree here. I just made a video recently, and I was going to actually start making a few videos of topics that I don't care about or topics that I think people shouldn't worry about. And so, for instance, one of them that I haven't made a video yet on is velocity training. So, in like the strength
Okay.
and conditioning world, I see that I see some data showing that it's maybe helpful, but not enough to convince me that you should get a Tendo unit or do anything like that. Um, Another one I just made recently was on HRV. And if I'm recalling correctly, I think you've made some posts on HRV and maybe how
Mm-hmm.
you utilize it. That was one that for me, I was like, look, man, I just don't see that much of a benefit from it. Now I'm talking about from the standpoint of, at least when I made my video, was for muscle gain, like hypertrophy or
Sure.
fat loss or anything like that. Not touching on health. So my stance on it was that I just don't think it matters. I don't think the data is compelling. I think the more data that comes out, the more that shows that it's not overly helpful. But you might completely disagree with me. So let me hear your thoughts on HRV.
So are you saying that HRV is not helpful for improving athletic performance, or just
So
overall to a useless marker?
I was specifically talking about it from a hypertrophy standpoint, or I should
Sure.
even say like strength training standpoint. So the data I've seen shows that it can be used for some benefit, but I've seen more recent data showing that compared to other autoregulatory measures, it is the same or inferior compared to, let's say, even like a vertical jump. If you were to test that to kind of gauge
I see.
how well you perform, and
No,
even then,
I don't think I
go
disagree
ahead.
with you there at all.
Okay.
I don't think anybody who thinks that HRV is going to give them any insight into their athletic performance or be a proxy for their, their 40-yard dash or their vertical jump or their bench press, I think you're mistaken if you're trying to understand it in that respect. And I actually, that's the first time that I've heard somebody try to make that claim that it's
Really?
a proxy for that. I have never. I mean, I know what I do know is that athletes who improve their endurance type of training and try to get into their zone 2 type of training, that their HRV increases on that day. But I
Mm.
don't know what necessarily that means in terms of their athletic performance. That just means that it impacts their nervous system and their autonomic nervous system and their cardiovascular health for that particular aspect. But no, I would agree with you. I don't think there's any evidence or any convincing evidence that would suggest that it, like, if your HRV is higher, then you're a better athlete or you're more likely to be successful. But I think the literature does strongly support the fact that HRV is a great indicator for your sympathetic tone or your parasympathetic tone and your ability to recover overnight. And we do see that individuals. So a great example of this is alcohol will directly reduce your HRV.
Mm.
Like overnight, it will completely do that. And even not sleeping or having caffeine. And HRV can be a proxy for your nervous system recovery and also for your ability to, it does correlate with sleep cycles. So that is more of the literature that I would say can help athletes in terms of their recovery, but not necessarily in their actual performance or their output.
Right. So just to clarify, so the way that I've seen it used was basically, okay, you're measuring HRV. If it's higher, you can use as an indication that you're recovered and ready to train again. Whereas if it's lower, you'd say, oh, okay, maybe I need a little bit more rest. And I guess some data has shown that that's maybe a good proxy for showing when you're ready to go again. But again, for me, I just don't think it's very useful. So for you, how would you utilize that data then regarding the sympathetic nervous system? Like, how would you actually implement that into changes that you'd make?
So it allows me to assess my exercise intensity. So I know for and I'm a little bit of a unicorn. So my HRV is extremely high. Like I think my average HRV, and I've measured it using an Apple Watch and using my Oura Ring. My HRV varies from like 100 to 115.
Hmm.
The average person has an HRV of like 30.
Jeez. Okay.
So I don't know I don't know what that means. But what I do know is having a higher HRV doesn't mean that you're better than somebody who has an HRV of 10 or 20 points less. So if your HRV is 50 and mine's 100, that doesn't mean I'm double you. That doesn't even mean I'm 1.1 times better than more athletic or more efficient in my exercise regimen, right? But what it does mean is the inter variability between your own intra variability. So if my HRV is average 110 and then on a few nights it drops down to 80, then that's a 20 to 30 point drop. That's telling me that my autonomic nervous system is dysfunctional. I'm probably hypersympathetic, not a parasympathetic enough, and that my sleep quality or my sleep stages have likely diminished. And that tells me that I need to scale back on my exercise intensity. But it doesn't mean that if my HRV is 100, that I'm super athletic compared to somebody who's not. So
Right.
it does allow me to tailor my program and allow me to figure out if I'm getting enough sleep, maybe I'm having caffeine too much, or drinking or eating late. Like those are the things that have an impact on HRV. I don't think it's an absolute number, but I do think it's a good way to guide you in the right direction. And it's kind of like the same thing with like fasting blood glucose. I don't think that if you had a fasting blood glucose of 109, that you are at risk. But I think if you've had a fasting blood glucose of 109 5 times,
Hmm.
then that data and that the mean tells me, well, this is higher than what is average, and I don't like this number, and then it tells me something that we need to change. And
Right.
that could even just be hypercortisolemia. It doesn't need to be that you're insulin resistant. Because remember, cortisol can increase blood glucose levels, and that's another aspect that you have to pay attention to.
Sure. So you mentioned sleep there a few times. You mentioned the Aura Ring, and that was kind of the last question I had for you was, I think, have you read or you probably heard about Matthew Walker's book, Why We Sleep? So that came out, and then there was actually an article maybe a few months ago, kind of like debunking a lot of what he said, or at least attempting to. So I had Dr. Greg Potter on, who has a PhD basically in sleep, to kind of talk about the book versus the article and all of that. One thing we did talk about is this kind of like orthosomnia that happens where people, they hear how important sleep is and they start to buy something to track sleep, and then they buy something else to track sleep, and then they talk about sleep, and they get so obsessed with it that, and I've even done this too, not to that extent, but near, actually I would say to that extent, because I've had 2 sleep tests done, so another dig at me there.
More than
uh,
mine.
yeah, so, and basically just saying like, man, I'm just trying to perfect my sleep, and in doing so you almost get worried about it and you end up hurting your sleep, or there's this kind of like nocebo effect for things you do. So can you kind of tell us like how you balance that out for yourself and patients?
Yeah, absolutely. I think Matthew Walker is a brilliant man. I think a lot of the data that he's produced has put a lot more of a focus on sleep. There are a few areas that he discussed that I really don't think that are pretty much, I think, inarguable. And one of them is the fact of sleep on cognitive decline, um, uh, more acute and then also more long term. And what we know is that when you're unable to sleep, it does have impacts on your ability to go into autophagy and also with helping with your brain recover. And we see this all the time clinically. If people don't sleep, they're not as sharp. They don't do as well on exams and tests. So that's one area that I would say, like, this is pretty evident that this information is accurate. I'm not sure which part of the article has tried to debunk some things that he said, and would love to see that. So please send that over to me because I'd
Yeah,
love
we'll
to
do.
assess it. Because I want to know myself, because everything that he has said has been quite accurate. But how do I help people with this obsessiveness over sleep? And I don't utilize sleep trackers as a way to tell me, is your sleep good or is your sleep bad? I utilize it as a way to tell me, has your sleep changed?
Hmm.
And that is most important. And even if you talk to any type of sleep specialist, an Oura Ring and an Apple Watch and a Dream Machine and all these other things that are used to help assess your sleep are not, they're not a substitute for a polysom, right? For a sleep study. And the sleep diary or a sleep log allows you to have a lot more information on this topic than just talking about getting data from a ring or anything like that. But what the ring can do is it puts things, it allows you to visualize them, or a
Right.
watch, whatever it is. It allows you to visualize them and allows you to see, like, hey, I got 6.5 hours of sleep tonight. I feel like crap. I should probably try to fix that. But then it becomes obsessive. And then there are people who over fixate on, I only got 6 hours 45, but I feel great. I feel like I slept well. Nothing is going, poorly for me. Then you really need to take into consideration, like, maybe you're having a really good quality of sleep. And then I look at things like the PSQI, which is a questionnaire that can assess your sleep quality. And then I try to, assess if they have sleep apnea. Again, this is the art and the science of medicine. This is where I really get back to, like, I practice good medicine because I don't rely just on a test. I don't rely just on a number. I talk to the patient. The patient is the person who I am, like, the person in front of me is the person I'm trying to help. And if I see that they're getting obsessed, like, men do this all the time with their testosterone levels. I want to check my testosterone. I want my testosterone levels. I want my free testosterone. I want my total testosterone. I want all this other stuff. I'm like, well, are you symptomatic? Are you showing
Hmm.
symptoms of testosterone? Are you feeling fatigued? Do you have sexual dysfunction? Are you have low libido? Can you not increase muscle mass? Are you gaining body fat? No, none of those things. So what is a number going to tell me?
Yeah, right.
Right? Because if you really want to go into it, then we could talk about testosterone receptors and androgen receptors, and maybe you just have enough to activate the receptors for you. So you have to really take the art of medicine, understand that you're speaking to humans, and they, like, social media annoys the shit out of me, right? Because there's always an expert who's going to come out, and this is why I do my Sunday series. So I do what is now called, like, Real Talk Sunday series with Dr. Esposito. It's on Instagram, and basically I try to uh, bring light to a lot of areas that people are over really overrepresenting or being misrepresenting, right?
Hmm.
Misconceiving the public. And this is where it comes in. It's like people are like, oh, well, you need to get, this type of supplement or this type of sleep, because people are fixated on trying to be trendy with everybody else. But let's try to get down to the actual facts, because you can't take advice from any general person on social media. Everything needs to be individualized and personalized for the person. And that, I think, to your point, is there is an obsession because people are trying to fit in with the mass. And really, when I come down to it, it's basically N of one medicine, right? You are the N of one. I need to treat you in front of me, not, an N of 3,000. We don't treat studies. We don't treat people. We don't treat groups. We treat individuals. And I think that's one of the major points that your listeners really need to come away with is don't try to treat yourself and don't try to just follow one metric. Try to find a doctor who really understands your whole picture and your whole story.
Awesome stuff, man. This is a great talk, and I don't think I actually mentioned, we talked off air about the charity for today. I don't think I mentioned that once we started recording. So in case I didn't, for everybody listening, where I'll be donating today is called Walk MS. It's for multiple sclerosis. Somebody actually reached out to me on Instagram asking if I could donate to this charity. I thought that was a great idea. And if other people are listening and you have specific charities that you would love to have a donation to, just let me know and we can try to work it in. So there will, of course, be a link below for that. And Ralph, where can people find more of your stuff?
Yeah, you can. The easiest way to find me is on Instagram or on Twitter at Dr.RalphEsposito. Shoot me a DM, comment, whatever you need to do. I love to put out new material that people are asking for. So if you want to learn more about something, and that's really what I focus on, is trying to educate people. So those two avenues are the best way to find me.
Awesome. Thanks so much, man.
Thanks.